Hello, dear friends. Today I want to talk to you about the link between our hearts and our mind and our nervous system. And then I want to discuss how essential oils can help us heal our hearts through these interconnections of neurocardiology, psychocardiology, and psychoaromatherapy. So those are some big scientific words, but we're going to go through all of them. Our emotions and our mindsets have a profound influence on our overall vitality and our well being. And it's known that what impacts our mind impacts our physical health, including our heart, and vice versa. So it's probably no surprise to you that we are whole people and that our organ systems are interlocked. But when allopathic medicine became predominant, the mind and the body were treated as separate. And clinical trials and evidence-based medicine became the standards of care. Natural remedies and the therapeutic relationships that were between doctors and patients went to the side over our need for gold standard treatments and clinical trials. They were no longer revered as they were in the past. And disease has become viewed slowly as a biological manifestation of symptoms that need to be suppressed. So, what we've ended up with in conventional care is siloed medicine with 24 specialties treating different organs and not really putting them together in this one interwoven piece. It was only recently that integrative and holistic medicine have become more mainstream. And don't get me wrong, modern medicine can be very life-saving and it's needed and it's necessary, but it's a sick care system and it's failing to keep us well. When we're in acute trauma or when we have something where our body is so overwhelmed that it needs heroic measures, conventional medicine shines. But for chronic disease and keeping us into wellness and resiliency, it's very weak. It's rarely looking at the root cause of the problem and really only addressing the symptoms. And this is especially true when we're caring for our hearts. I talked about previously American Heart Month, which was proclaimed in 1963. And even with all this attention in February to heart health and with Valentine's Day that coincides, heart disease is still the number one cause of death in our nation. So if you missed the previous video, I went over some of the standardized approaches and treatments to cardiovascular care and why it's a problem. I discussed the narrow focus on common risk factors such as lifestyle and cholesterol numbers while ignoring the psychosocial aspects that are just as important. These include socioeconomic conditions, mental health, and relationships, and they're often not addressed as far as risk factors. We also talked about an approach that addresses the root cause of heart disease and incorporates the links between the mind, the body, and the heart and relationships. And this is through the mind-body application of essential oils. So what I want to share with you in this video is a deeper dive into the holistic aspect of healing for our hearts. We're going to examine this interconnection between our beloved organ, our nervous system, and our psychology. We'll explore how essential oils benefit our physiological functions and the pumping organ while they're aiding the emotional attributes of the heart, brain, and the nervous system connection. So I hope that after taking in this information, that you'll come to understand how important it is that we keep a mindset of healing to mend our hearts. As always, all the links to the references, the studies, and the resources will be available in this accompanying article if you want to check those out. But let's get started. If we're talking about psychocardiology, it's a big word, but it has big impact. It explores how heart conditions may increase the risk for psychiatric illnesses, while at the same time, there's a connection between mental health conditions, high stress levels, and cardiovascular risk. According to a review article of medical literature from 1995 to 2012, and this has been validated as well, there were several aspects that were associated to cardiovascular disease related to our psychology. These were stress, anxiety, depression, social isolation and social support, psychosocial work environment, acute and chronic life events, and personality type and hostility. Of all of these factors, it was stress, mental health, and relationships that had the strongest influence on heart disease outcomes. The authors address the powerful role of social support as a number one predictive factor for heart risk and mental health issues. They talked about it as a major protective factor for cardiovascular and heart disease, and have shown that perceived social support during hospitalization actually decreased depressive symptoms after somebody had been hospitalized from a heart event. Many studies have shown that after a heart attack, the rate of depression depends on the amount of social support. And the study showed that different types of stress, including anxiety, depression, social isolation, social support, acute and chronic life events, hostility, and type A behavior, that among all of these different stressors, social support is the most important out of all other variables. So it isn't only the lack of social support that's associated with the occurrence of cardiovascular heart disease, but also an independent risk failure of our mortality. And as you can see, it's interlooped with the mental health and the risk for cardiovascular disease. So they're all interconnected in this psychocardiology model. Now, stress, lack of social support, and mental health don't just impact our mind and our heart, they also affect our whole system and our nervous system. Neurocardiology, the other big word, is a connection between the heart and the nervous system, and it has many dimensions. Studies have revealed that the quote stress neurotransmitters of norepinephrine and epinephrine, or if you prefer adrenaline, noradrenaline, can cause changes in the heart physiology at the cellular level. And what this means is that these stress compounds literally influence the heart function and structure. One review talked about how stress impacts the body, and the authors summarized how the heart entrains with the nervous system by affecting blood pressure, blood lipids and blood clotting factors, heart rate and rhythm, and oxygenation of the heart. And we probably intuitively know this, that when we're stressed, our heart beats faster, it's harder for us to catch our breath, and there's a connection between stress and cardiometabolic diseases or blood lipid issues. So these concepts haven't just been validated through associated and mechanistic studies, they've also been demonstrated and measured through the electroencephalogram or EEGs, the electrical activity of the heart, as well as heart rate variability, which is a measure of stress and resiliency. So this means if we start at the level of the mind, where stress is interpreted, we can prevent many of the negative downstream effects of stress on the heart and its entrainment with the nervous system, the neurocardiology aspect, as well as the stress impact on our psychology and social support, which is psychocardiology. The cool thing is that essential oils can help with both of these aspects. So here's where one of my favorite modalities comes into play. Now, essential oils as an overview support cardiovascular health and emotional well-being because of their biological and psychological effects. That's called psychoaromatherapy when we're talking about the psychological aspects of essential oils. Our little aromatic allies actually influence neurological signals and the emotional brain, which in turn influences the heart, our mind, and our nervous system. Let's dive deeper into essential oils for emotional heart healing. It's related to predominantly the aromatic nature, but I'll get into the biological nature a little bit later in the video. But essential oils basically can be used as a way to process our emotions and uplift our mood. This is the psychoaromatherapy part, because aromas actually reach the brain's limbic system, which is our emotional and memory center, and it creates an instantaneous shift in our emotions. In fact, there's no relay station to the brain. Smell directly impacts our emotional center. So this influences our mental state directly before we even have a conscious awareness of it. As a result of this direct influence of smell to our brain, inhaling essential oils can create this pattern interrupt to our brain's imprinting of a stressful or a traumatic or emotional trigger. And rather than reinforcing those feelings of stress or emotional overload, helplessness, sadness, this scent that we inhale can actually promote a sense of comfort and nourishing and nurturing and calm, helping our well-being to be restored and to feel more security and hope in the situation. Now, at the same time, essential oils also carry with them biochemical compounds that actually can alleviate some of the physical as well as cognitive manifestations associated with grief, trauma, stress, or hard emotions. So, this means that essential oils can further support mental health by aiding better intimacy skills and stronger connections because we're less reactive to triggers in our relationships when the brain is in a calmer state. Essential oils are also valuable and probably best known for stress relief, and they also aid in the biological impact of chronic stress that we've been experiencing. They quickly impact the brain, which influences our heart and nervous system. So here we have the psychocardiology as well as the neurocardiology impact here. And this is because they soothe the limbic brain, which we talked about, to tame the emotional and nervous system reactivity caused by stressful events. They modulate vagal tone, calming the nervous system. They can support neuroplasticity within the brain, which contributes to improved behavioral response patterns. They influence hormones, which impact our brain function and emotional balance, and they affect the hypothalamic pituitary adrenal axis so that this promotes communication between the brain and the endocrine system. And this is through their ability to modulate cortisol, the stress hormone, hormones in general, neuroinflammation, and neurotransmitters, which impact our mood as well as our overall body functioning. So that is how essential oils impact the psychocardiology and neurocardiology, heart, brain, heart, nervous system link. They also affect our biological heart just through their biochemical properties. And these compounds can mediate various triggers that can lead to poor circulatory function. That's because they have anti-inflammatory and antioxidant properties. So they actually help protect the cellular properties of the heart. They can help promote circulatory flow. They can mediate neurotransmitters and hormones related to the signal from the heart to the brain. They can boost immune response, and they can help the body detoxify toxins, which would compromise circulatory function. And I did a whole podcast on essential oils and cardiovascular health, as well as discussed not only how they can impact cardiovascular health, but some of my favorite essential oils. And I will include a link to that podcast in the video description. I also reviewed it a little bit in my previous video on holistic cardiovascular care. So, if we summarize this link between our heart and our brain and healing our hearts holistically with essential oils, let's review where we've been. Conventional medicine is missing the mark when it's trying to achieve better heart health outcomes. There's too much emphasis on suppressing symptoms, manipulating lifestyle factors, and providing medication to suppress cholesterol. Often, treatment ignores the vital influence and just important, if not more important, mental health, socioeconomic, relationship, and other whole person aspects associated with cardiovascular disease risk. We talked about this holistic connection between the heart and the brain, known as psychocardiology, and heart and the nervous system, known as neurocardiology. We reviewed how mental health and psychosocial factors can predict heart health outcomes. We talked about how the heart entrains with the nervous system and how stress is a common factor that influences our mental and nervous system state and relationship interactions, and therefore our heart function through this heart-brain, heart-nervous system connections. Essential oils influence our mind's perception of emotional triggers as well as stress through their direct connection to our emotional center of our brain. So this is the way that they intercept at the level of the mind to positively impact our mood, our nervous system, and our heart. And their biological properties additionally aid in alleviating stress while enhancing our well-being and physiological balance of the heart and other organs on a physiological level. Integrative naturopathic and functional medicine incorporates these mind-body practice, which is vital today if we're going to heal our hearts holistically and get better cardiovascular disease outcomes. And I think it's essential for us to look at these psychosocial aspects as well as the connections between our heart and our other organ systems and our mind and our nervous system to truly heal the hearts of our nation. Now, I hope that this information inspired you to think beyond cholesterol numbers, lifestyles, and diet for heart health. I think we've seen that that is just not a full encompass of what health and wellness really is when we're just looking at the physical. So stay tuned. You want to make sure to subscribe to my email newsletter that I send out every week because in that subscription, you will get free weekly blogs. You'll get information on associated products, sneak peeks into some of the things that I share with only my clients that isn't available on social media or isn't available on my website, and some things I share only with my community. You'll also discover my community membership program and be the first to know about educational opportunities with me, questions and answer series, and etc. So there will be a link in the article. Be sure you check that out.